Imagine you suddenly being chased by a dog. Your heart starts pounding, you begin breathing faster, your blood pressure rises. Why? Because your body has released adrenaline. Now imagine a medicine that tells your heart, relax, slow down. And that medicine is called beta blocker. By the end of this video, you'll never forget how beta blockers work. So, what are beta blockers? So, beta blockers are medicines that block the effects of adrenaline and noradrenaline on beta receptors. To understand how beta blockers work, we first need to understand how beta receptors work. So, there are three types of beta receptors: beta 1, beta 2, and beta 3. First one, beta 1 receptors, they are mainly found in the heart and kidneys. So their functions when stimulated are to increase heart rate, force of contraction, AV node conduction, and also increase in renin release from the kidneys. Then beta 2 receptors, they are mainly found in the lungs, blood vessels, uterus, and liver. And their functions when stimulated are to increase the bronchodilation, increase the vasodilation, decrease or inhibits the uterine contraction, and increase the glycogenolysis in liver. And next one is beta 3 receptors. They are found in fat tissue and are less important for today's discussion. Their functions when stimulated are to increase lipolysis and increase the thermogenesis or heat production. So, beta blockers basically work by blocking these receptors and preventing the actions of adrenaline. When you're stressed or frightened, your body activates the sympathetic nervous system. Then, adrenal glands release adrenaline into the bloodstream. Adrenaline then travels through your bloodstream and binds to the beta receptors. When it binds to beta 1 receptors in the heart beats faster, contracts more forcefully, and kidneys release more renin, preparing your body for action. Now, what do these beta blockers do? These beta blockers occupies the receptor and hence blocks the adrenaline. Think of the receptor as a lock. Adrenaline is the key. Beta blockers covers the lock, hence preventing the key, which is adrenaline, from entering inside the lock. As a result, adrenaline cannot produce its usual effects. Now, since the adrenaline cannot stimulate the heart rate decreases, the force of contraction decreases, and the blood pressure falls down. The heart also needs less oxygen. The oxygen demand is less. That's why beta blockers are useful in people with angina and after a heart attack. As we said previously, beta 1 receptor are also present in kidneys. So, beta blockers basically reduce the renin release and hence lower the blood pressure. Now, let's see the classification. Not all beta blockers are the same, they're classified based on the receptors they block. Non-selective beta blockers block both beta 1 and beta 2 receptors. Examples are propranolol, timolol, nadolol. Then cardioselective beta blockers primarily block beta 1 receptors mainly in the heart. Examples are metoprolol, atenolol, bisoprolol, etc. Then there's mixed alpha and beta blockers. They block both alpha and beta receptors. Examples are carvedilol and labetalol. Beta blockers are used in many medical conditions. They help treat the hypertension and help with chest pain in angina pectoris. Certain beta blockers improve survival in heart failure. It is helpful in controlling abnormal heart rhythms in post myocardial infarction, reduces the risk of death and prevents future cardiac arrests. They can also help prevent migraines, reduce symptoms of hyperthyroidism, treat essential tremor, lower intraocular pressure in open angle glaucoma, in performance anxiety, aortic dissection, etc. Now, let's see some of the side effects of beta blockers. Since beta blockers slow down the heart rate, they might cause bradycardia and lower the blood pressure, which may cause dizziness or lightheadedness, and also fatigue and dizziness. One important thing to note is that the non selective beta blockers can also block beta 2 receptors in the lungs, causing bronchoconstriction. That's why they are generally avoided in patients with asthma